and to control my emissions. My
Right.
emissions are droplets, okay? So I emit less droplets because I have the mask. You emit less droplets because you have the mask. And that's why it's important. In the healthcare facility, they do it for both situations because I want to be sure that I don't receive yours and because I don't emit. But primarily for the healthcare workers in an intensive care unit will be so they are sure that they cannot have any kind of droplets coming in. In our situation, it's more about I'm going to reduce my emissions and you reduce your emissions. So the subject and the objective is a little bit different.
Right. And what about, so we've spoken about this droplet transmission. So it's primarily, you know, my coughing, my sneezing, my loud, you know, shouting, or, you know, things that encourage spray to come out of my mouth or nose and onto a surface or onto a person. What about sweat? Is there any evidence of sweat having, you know, because I see people outside exercising and they're, you know, going at it sometimes. And is there, or do we know yet, because we might not know, if there's a possibility that COVID-19 can be transmitted via, you know, other kinds of body fluids such as sweat?
I haven't seen any evidence to support such. The virus has been detected in some types of body fluids and so on, but in terms of the transmission, I haven't seen anything to support that. I don't know, Marcelo, if...
No, I totally share what you're saying, Karen, and I give you another example, not exactly on the sweat component, but one thing that has been seen in the evidence is the presence of the virus, for example, in our human waste.
Yes.
That has been the presence, but the fact that it's present doesn't mean that it's transmitting. So
Right.
there's not really an issue with the transmission of the virus to even like a oral fecal type of transmission, as we call, more than there is the presence of the virus. So maybe present, but they have not been evidence to show that really is a way to transmit. But the example that you say, Ashley, which is really important, is when people, they really, sometimes they get concerned that they walk in a street and they see somebody running too close to them, right?
Yeah.
And they get a little bit like, you're too close and you're not wearing a mask. Oh my God, they're gonna get infected. Think about how long really are being exposed to that person. Maybe 3 seconds, 2 seconds, one breath. I don't think that that's really a big concern. It's not enough to really, unless the person really exactly runs and coughs and sneezes exactly at the moment that passes through them, that will consider that it's of a major concern.
Okay. And we've had 3 questions actually come in that are all very related. So one is from Fernando Hernandez, then we have another one from Julian Sanchez Castillo, and then Lawrence Boy. So they're talking about how effective it is to disinfect hospitals and train platforms and hotels, that, you know, those public spaces that when public health measures start to get lifted, we're going to be coming into frequent, or possibly coming into frequent contact with again at some point in the future. You know, what should companies be doing to start preparing for that when that, you know, eventually happens, in order to protect, you know, members of the public, tourism? You mentioned, Karen, that was something that was being discussed in your office. What do companies need to do to keep us safe?
Well, thankfully, some companies have already started to put things in place. So especially here in the Caribbean with, we were on lockdown, and now some measures are being lifted and so on, and some sectors are reopening. The cleaning and disinfecting of buildings and so on has taken priority. In one of our islands, actually, the environmental health officers have to certify the business place as being ready for opening. So that cannot happen unless it's certified by environmental health person. And what that means is basically checking to ensure that the business owner or operator has installed, for example, hand washing stations. There's hand sanitizing stations also. If it is a business where persons have to go in to be served, then there's the physical distancing in terms of markers on the floor, the ensuring that there's enough supply of disinfecting solutions for the staff to do that, and there's a schedule of how frequently it is going to be done and so on. In our supermarkets, for example, we have, you're lining up outside, of course, distance from each other, but before entering, there's someone there with a bottle of hand sanitizing spray your hands and your bags that you're taking inside. There is the station for cleaning your hands again, and then the supermarket carts and so on, they are sprayed and cleaned down, so reducing the risks. So businesses have been doing that. The frequently touched surfaces are being cleaned, the light switches, the door handles, and so on. Some companies have increased the in terms of the contractual arrangements they have with cleaning company, they have increased that, so someone is coming in instead of just at the beginning and the end of a day, maybe twice in between, to ensure that the frequently touched surfaces are clean. And also we have to emphasize that the as individuals, we also have a responsibility for ensuring that we also practice that personal hygiene and so on. So, I mean, if you have a desk space, make sure you don't have all these different ornaments on your desk that makes it difficult to clean. You have your companies are providing, whether it's alcohol or whatever disinfectant, for persons to be able to wipe down your keyboards, your telephones, that kind of thing. So it reduces the risk. So that has already been I think in many, if not all islands, that has already started. And of course, the protocols have been developed. So we assist persons or companies or the governments in terms of giving them guidance on the prevention measures and the cleaning and disinfection measures that businesses need to have in place.
And Ashley, just to complement Karen's statements on that, at the same time, if you talk about, let's say, offices, right? And like you said in the beginning, Ashley, we were in sort of stay-home environments for a long time, right? I mean, the stay-home measures for a long time. So many of these offices have been empty for quite a bit of time. So some of the questions that we received is that guidelines, to develop guidelines, they were saying, so we really have to do a deep disinfection of the offices now, and and says, no, wait a minute. These offices have been empty. I mean, they have been empty for long enough that even the last of the viruses probably is like it's gone and forever. Those, yes, follow a cleaning procedure, follow a disinfection procedure, and then clean, and then keep a cleaning maintenance type of thing with the nature of what Karen just mentioned. But in the beginning, you don't have to really go crazy, and all of a sudden say, I'm gonna disinfect the last little thing in my office before I go in. There's no need for that either, especially in those offices that we know that for 3, 4, 5 weeks, 1 month, 2 months, that the people have been working from home, they have been empty. I mean, I see very little evidence that the virus will survive for 2 months on the surface of something that has not been exposed by a human in those 2 months. So we have to, again, see what the context. However, when you talk about hotels, and that's really my kudos to the Caribbean islands, because they use environmental health officers to really certify, especially the places that they're really with a lot of rotation of people, like hotels, with like public transportation. These are spaces that they get movement of people very, very often, and people that you really have no control whatsoever. And therefore, kudos that they really are trying to do this certification. Kudos that they're trying to follow these procedures, because that's really the places that they are really very much needed. They are places that they really get really a lot of movement of a lot of people of different origin that you don't have any idea where people are coming from. And then it's our responsibility to keep those places clean and to an extent certify that they're clean. So kudos for those measures that they're being taken.
So the Caribbean is, and I guess with such a flourishing tourism industry, it's really taking these things into account when it looks at reopening. Okay. So I just have one final question for you both, because we're getting to the end of the Facebook Live now. We've spoken a lot and we've had several questions about keeping things clean and disinfecting and measures that we should be taking in healthcare centers. But I think what's more relevant to us is the home. But certainly since this crisis began, there has been a real shortage in many areas, there is here where I live, of these disinfectants and things to clean surfaces, to clean the doorknobs, to make sure that our food is, washed and kept safe. In the absence of, the bleach and the general antibacterial disinfectants and the alcohol wipes and the hand sanitizer and whatever else, is there something else that I can be using that's going to keep myself and my family just as safe as if I had access to all of these cleaning products that people are talking about and that are so coveted, it seems, during this pandemic?
Yeah, Ashley, we also had a shortage. We had a shortage of bleach, we had a shortage of Lysol. We also had shortages of hand sanitizers, because why? People forget the good old soap and water. So soap and water, hand washing. You do not have, if you do not have access to disinfectants and so on, hand washing, and try to, as much as possible, avoid touching the mouth, eyes, and nose. That's it.
Absolutely. And one thing that even it was mentioned is to repeat soap and water that Karen just said. Absolutely. And on top of that, please, no antibacterial soap and water. Soap and water. Okay.
Soap and water.
The issue of this antibacterial type of thing, in the end, it may end up doing more harm on the sense of what we call the antimicrobial resistance. So we end up sending things to water that they have these elements that they are to kill bacteria. No need. Soap and water. The old soap over hundreds of years that have been in use, it's a wonderful element and people can continue. It's nothing fancy about it, but it's effective.
It's effective. And I guess we can also use that, on a cloth to clean our surfaces and, things like that at a push as well.
Absolutely.
Brilliant. So on the final words of soap and water, I will end this Facebook Live. Thank you so much, Karen and Marcelo, for taking the time to join us. For any audience members watching from Latin America particularly, my colleague will be leading another Facebook Live today at 2 p.m. Eastern Time, Washington, D.C. time, on the same issue, with Marcelo, I think, and with one of our other experts in Spanish. So if you're a Spanish speaker and you have any questions, please come back this afternoon and we'll be having the conversation again. But thank you so much. And we will be back next week on Thursday for our, I think, 5th edition will be on there of Ask the Expert within the context of COVID-19. So thank you very much and goodbye.
Thank you too. It was a pleasure.
Goodbye. Have a good day.
Thanks.